Every single one of us must have heard of cancer by now, whether that's through witnessing a loved one being diagnosed or even going through it yourself. It's a given fact that statistically, 1 in 2 women and 1 in 3 of men will develop cancer in their lifetime. We can all agree that cancer is a big issue in our society. I'm certain that we can all also agree that early detection and diagnosis are indispensable for improving the prognosis of cancer patients. And one particular cancer, pancreatic cancer, we are yet to achieve both of these indispensable facets. In this video, I will explain how worms going by the name of C. elegans have the ability to sniff out pancreatic cancer even at the very early stages, and finally, why this is relevant to you. Several reports have emerged regarding canine scent detection of cancers. Since Williams' first report regarding the ability of sniffer dogs to detect skin cancer, a number of studies have indicated the ability of dogs to detect cancerous lesions, including those in the bladder, lungs, breast, and even ovaries. However, Williams also reported that canine scent diagnosis may be difficult to introduce into clinical practice owing to the expenses and time required for canine training and education. Similar to sniffer dogs, the use of C. elegans, which are transparent worms about a millimeter long that live in soil, particularly around rotting vegetation, has been introduced as a new strategy for detecting cancer-associated scents during cancer screening. Aside from having an excellent sense of smell, C. elegans are inexpensive, quick to breed, with over 1,000 eggs daily, and are easy to handle in experiments such as the N-nose experiment. Now, all you need to know about the N-nose experiment is that it is an established system for analysing the movement of the C. elegans worm in response to chemical signals. Now, in the study, the cancer researchers performed a study in 83 patients with very early stage pancreatic cancer. They observed the movement patterns of the worms when they were exposed to urine samples from both the cancer patients and healthy controls. What's really fascinating is that they found that the C. elegans worm would display attractive movements toward cancer cells and cancer-associated cells found in cancer samples as opposed to samples from patients that didn't have cancer. This is because those patients with cancer, their samples, i.e. their urine samples, contained compounds and substances that are specifically produced by cancer and cancer-associated cells, and not non-cancerous cells. What's even more fascinating is that they found that the test had a sensitivity of 95.8%, even when the patients were in the very early stages of the disease. After undergoing surgery to remove the tumours, the patients tested negative on the N-nose experiment. What's really exciting is that the researchers are confident that their cancer screening technology could soon become standard in diagnostic labs. The authors wrote that the clinical application of C. elegans for the early diagnosis of cancer can certainly be expected in the near future. Now, this is very important for all of us, as early detection and diagnosis are indispensable for improving the prognosis of cancer patients, and is a given fact that statistically 1 in 2 women and 1 in 3 of men will surely develop cancer in their lifetime. Okay, thanks for listening everybody, and please subscribe for more videos like this. I welcome any thoughts and comments regarding the video in the comment section below. I'd like to also point you guys to the video on the screen now, explaining some of the potential anti-cancer properties of the fruit pomegranate.